now because Americans are going bankrupt paying their medical bills. That doesn't happen in England, France, Germany, Switzerland, Japan, any other industrialized country except the United States. And I think that is intolerable and an outrage. Thousands are going bankrupt every year. Second reason MAHD has held is that millions of Americans are not getting basic health care. What is basic health care? Well, what your doctor does two things. He gets you out of trouble, and he keeps you out of trouble. When he's getting you out of trouble, you're in an emergency room, and you're in the hospital, and that's maybe 1/10 of your medical life needs. 9/10 of it is done in the clinic. He's keeping you out of trouble. Here's an example of how that works. Sonia Sotomayor, our Supreme Court Justice, she was diagnosed at age 9 with diabetes. That's juvenile diabetes. That requires insulin and shots. Now she's 39, and she's in good health. She has none of the major complications. No renal failure, no blindness, no nerve disease. How did that happen? Not by accident. She went to the clinic time after time and worked with her physician assistant, her family doctor, her nurse, her dietitian, her pharmacist, and she worked and worked and worked on her blood sugar, and now, 30 years later, she's without complications and in good health. And what's going on now out in the country, millions of Americans have no insurance. They're not going to the clinic. They're not seeing their doctor. Their cholesterol isn't controlled. Their blood pressure isn't controlled. Their diabetes isn't controlled. And that's just 3 diseases.
15 seconds.
Okay, so they're not getting, and this is basic health care. It's not a transplant. It's not bypass. It's basic stuff. It's not that expensive, but it's very important. It's as critical as critical care. And Americans aren't getting it, and that's why I'm angry, and that's why I'm upset.
Dr. Bob Steward.